And now to the story of the Social Health Insurance Fund, which the government has said will be rolled out on the 1st of October. That even as the government remains upbeat on the new medical insurance scheme rollout, the fate of the Social Health Authority is dependent on the Court of Appeal's decision this Friday. The legal hurdle that saw 3 health laws related to the authority declared unconstitutional is just one of those challenges that the ministry must overcome before the 1st of October, which is the commencement date of the Universal Health Coverage Program. Brenda Wanga reports on the bumpy road ahead for the implementation.
The Court of Appeal is the next stop for the Ministry of Health as it continues with its rollout of the Social Health Authority. 3 laws, the Social Health Insurance Act, the Primary Healthcare Act, and the Digital Health Act, all of 2023, were declared unconstitutional on account of, amongst other things, lack of public participation.
The ruling of that is going to be delivered on our application for stay of order, which you have requested the court to grant us a stay order for the period and when the case will be heard and determined. That ruling will be issued or given on the 20th of September.
While the ministry remains optimistic that the court's decision will go in their favor, it is also preparing for a different outcome.
We are still within that period, we are still within that time. So we are waiting for the ruling on the 20th. So we are implementing the laws as is. But we take cognizance that if the court gives a negative verdict, we still have 120 days and we shall engage the leadership of Parliament for us to reenact the laws within the period that they had been given, the 120 days.
Legal matters aren't the only headache the ministry has to contend with on the road to October 1st. The Social Health Authority, as a legal entity, is required to have its own staff, and with the now defunct National Hospital Insurance Fund on its way out, it's unclear when and how the SHA will get its human resource requirements populated. The government, however, assuring NHIF staff that none of them will lose their jobs.
We submitted, as in my presentation, we submitted what's called the human resource instruments that were approved by the public service, giving the Social Health Authority the number of staff that they can employ based on their organogram, which they submitted. We have been given an interim approval to start the process, and the process will go on where those staff that had been already earmarked, identified based on the structure, they will be onboarded.
The ministry also has to contend with the challenge of the systems that will be used to roll out SHA. The ministry says systems including the Comprehensive Integrated Health Information Systems, the registration modules amongst other critical infrastructure are ready. But beyond the preparedness, the ministry is also staring at another challenge, that is a slow uptake of registration into the authority, with just 1.2 million people out of a possible 50 million so far registered. The ministry has its work cut out. The counties are also piling to the ministry's headache with the demand for clear-cut protocols for making payments for services provided.
So we need to have our one government approach to ensure that your priority is funding health. How it's going to be done, everybody has to be aboard. If you cannot give me money to take care of everything else, give me money to take care of health.
The ministry will be hoping that by the end of this week, the path to the rollout of the SHA will have become clearer. Brenda Wanga, Citizen TV.